Hi, you tired of searching YouTube and Dr. Google for exercises for lower back pain? I'm Dr. Harvey Markovitz. For over 45 years, I've been helping people just like you overcome their lower back pain, not by doing crazy circus contortion exercises, but by doing some very simple, easy to do exercises you don't have to crawl all over the floor or go to a gym to do. Watch this video. Tired of searching for a lower back exercise on YouTube or Google for this nagging lower back pain that you have? My name is Dr. Harvey Markovitz, and for over 45 years I've been helping people just like you get out of back pain. Not by doing some crazy contortionist exercise that only someone in the circus can perform, but very simple exercises that are safe and simple as well. So please watch this video. Please wait until the very end, because what I'm going to do is I'm going to show you modifications. So in case even this very safe and simple exercise is too difficult for some of you to do because you've been dealing with back pain for such a long period of time, I'm going to show you some really great modifications to really get you going to help you get out of pain as quickly as possible. This is an exercise for a muscle deep in the lower back that causes most people lower back problems. The muscle is called the psoas muscle. So what you're going to do, and the important part that most people don't do, is to do the side that's giving you the problem. So what you're going to do is, let's assume that the problem that you're having is on your left lower back. It doesn't matter if it's on the side of your back or the lower back or just going down your pelvis. And what you're going to do is you're going to get a cushion or a pillow, something that's soft for your knee. And you're going to put that knee, the knee that's the side of pain, onto that pillow or cushion. You're going to keep your back nice and upright. If you need a chair to hold you for support, please use it, whatever you need for stability. The other leg you're going to bring forward, and you're going to push the right knee, the knee that is forward, you're going to push it as far forward as you can gently, so it's either on top of your ankle or slightly behind it. The foot that's with the knee on the ground, you can either have your toes extended or you can have your knees or your toes bent. It really doesn't matter. That's your choice. You keep your back nice and straight. Now, if you're doing this and you're having pain in this area, you'll most likely feel a lot of pulling, a lot of tension, a lot of tightness in the front of the thigh with the knee on the ground. That is actually a very, very good sign. It tells you that this muscle is super tight. That's not really the psoas muscle, but that doesn't matter. It will give you the relief that you're looking for. You're going to maintain this stretch for approximately 30 seconds. You can go longer if you want, but you don't want to do it too fast because this muscle's been extremely tight, probably for a long, long time. So after you've done this for 30 or 40 seconds, you can get up, walk around. Do not switch sides unless you've done this several times a day, maybe 5 to 10 times a day, maybe 15 times a day for several days, and you realize, you know what, I'm not getting any relief. Then, only then, can you switch to the other side. But keep doing the one side until you finally get the relief that you're looking for. So now I'm going to give you modifications in case that is just too difficult for you to do. This is modification you're able to do in a chair. You must use this very solid chair like a dining room chair. Don't use an office chair that has wheels on it or with armrests. You won't be able to do it that way. So let's assume that you're going to do the same side, the left side again. So what you're going to do now is you're going to scoot yourself so you're more to the front of the chair. You don't want to be leaning back. Have your feet firmly planted. Then what you're going to do is you're going to move your butt to the left, slightly, so your cheek is slightly off the chair. Make sure you're still stable. Then what you're going to do in this position here is you're going to slide your left foot back as far as you can. Remember the tension that you felt in the front of your thigh? That tension is telling you this muscle is super, super tight. Hold this for 30 to 40 seconds, longer if you need to, but you must do this several times a day. And if you have an office job, go ahead and break up the monotony by doing it during the daytime as well. But must do it on a solid chair. And and as Tricia said, make sure you feel solid and you can do this with stability. Okay? Now, the next modification after this one is going to be with you standing. So in this position here, I want you to make sure you have something stable, either a wall or a solid chair to hold on to. And what you're going to do is you're going to put the same right foot forward, keeping your left leg back. Make sure your heel is planted flat on the ground, and you're pushing your right knee forward, and you're going to hold this position for 30 to 40 seconds, longer if you need to. This is a great way to do it if you don't feel comfortable on the floor, or for some reason you find yourself in a situation where you can't sit, you have to stand. This also works really well on a stairway. Third step up with your right foot would work really, really well. I hope you really enjoy this particular exercise that I've given you. It's worked for tens of thousands of people, and I know it's going to work for you. But what you must know is this. Not only must you do this exercise regularly, but you also must know the 5 exercises that if you are currently doing them will nullify the effects of this one here and actually make it so it doesn't work. So you must watch my next video in which I'm going to show you not 5 but actually 6 exercises that you must stop doing in order to get yourself out of back pain. So if you like this video, please say like it and watch the next video. Thank you. So after you've done the exercise that I've shown you with either the knee on the ground or do it in a chair or stair or anything else that's raised, now you must not do these exercises to make sure that you get the maximum benefit from that one exercise. So the first exercise you are not going to do is a standing forward bend. You're not going to bend over with your back nice and rounded, attempting to go ahead and touch your toes. This is going to crush the discs in your lower back and make them bulge. So this is the first one you're not going to do. The next exercise is going to be a similar exercise where you're going to be using a chair. And you're going to be sitting in a chair and you're going to be rounding your back, leaning forward. After you've been working hard all day with your back rounded, you're going to lean forward, touching your toes. Lean forward, touching your toes. There we go. This is again compressing the discs in your lower back. Number 2 not to do. Now we're going to move on to the third one. Third one to do, and a lot of people do this in yoga class, but you are not going to do it because you have a lower back problem, is you're going to be not doing it seated. So you're going to sit up, and you're going to try to attempt to touch your toes this way. Again, crushing the discs in your lower back. The next exercise you're not going to do is lying down, and you're going to straighten out your legs, bring one knee to your chest. Chin to your chest, again, crushing the discs in your lower back. And the second one, you're going to do the other side. And the final one, and the absolute worst of all 3, is to bring both knees to your chest. Not great for the lower back. The final one to do that rounds out your lower back is attempting to do a sit-up. This is a killer for the lower back. You will never strengthen your torso. You will never decrease the pain in your lower back if you're doing that one. So these are 5. Remember, they're all forward bending. Now I've got to show you another one that if you have a lower back problem, I don't recommend you do. And it's a yoga exercise, and typically they refer to it as the cobra. Now, this is not necessarily going to affect the disc in your lower back, but it is going to affect the area in your lower back that will gives many people lower back pain. It's called the facet joints. And again, if you do this exercise with lower back problems, you could increase the pain in your lower back. Those are the 6 exercises I highly recommend you do not do if you're having lower back problems.